A 61-year-old woman says she spent more than 5 hours lying on the floor of a busy hospital emergency department, vomiting and in intense pain, as staff repeatedly walked past her without offering help. According to the woman, identified as Juliet Carroll, she was rushed by ambulance to the William Harvey Hospital A&E in Ashford, Kent, on the morning of December 12 after suffering severe stomach cramps and relentless vomiting. Ms. Carroll, who is diabetic and requires insulin, said her condition was so bad that she could not even sit in a wheelchair and had no choice but to lie down on the department floor. Over the next 5 hours, she claims, staff did not check on her, offer pain relief, provide food or water, or move her to a bed, despite her being in clear distress. A photograph shared by her friend shows a nurse appearing to walk right past Ms. Carroll as she remained on the floor. "I was treated appallingly," Ms. Carroll said. "I didn't get any pain relief or anything else for hours. There was no dignity, there was no care." She also said that at one point she was briefly placed on an emergency bed, only to be asked to vacate it minutes later, and that the bed remained unused for the rest of her wait. A friend who stayed with her throughout the ordeal described the scene as chaotic, saying sick bowls and tissues were scattered around her, with other patients attempting to offer water or comfort in the absence of staff attention. People were stepping over her legs, she said. It was only around 12:30 p.m. that Ms. Carroll was finally seen by a clinician and taken to an assessment ward where she was diagnosed with a urinary tract infection and given anti-sickness medication and antibiotics. Even then, she was still unwell when she was eventually able to go home with a friend. Ms. Carroll has expressed her anger and frustration at the experience, saying she has paid into the NHS all her life but felt abandoned when in need. She also said she received no apology or explanation for the long wait on the floor. The East Kent Hospital's University NHS Foundation Trust, which runs William Harvey Hospital, acknowledged that the wait had been distressing and said it was sorry for her experience. The trust explained that emergency patients are prioritized based on clinical need following an initial assessment, and said it would encourage Ms. Carroll to raise her concerns with its patient advice service so they can be fully reviewed. The incident highlights wider pressures facing emergency departments across the region this winter, with recent NHS figures showing that many patients are waiting well over the 4-hour target time for assessment and treatment.